No questions. So earlier, I've shown you some of the words useful for your care plans. Okay, please help me complete all the sentences for your care plan. So assess, monitor, as what are those? Provide, administer. Number 5. Let's put assist. Number 6. Let's put educate. Number 7. Refer. Okay. So assess the level of, or assess the pain using, what tool are we using? Well done, Roslyn. So it's the pain assessment tool, or the pain tool chart assessment tool. Sorry for my spelling. I'm not a good assessment where we are missing T. There you go. Assess the pain using the pain assessment tool. So on the examination, if you say pain assessment tool, it already covers PQRST. Are we familiar with the PQRST? Yeah, it's the palliation, the quality, radiation, the severity. The severity is your 0 to 10, and then T is your timing. Happy with this? Assess the pain using the pain tool chart. So again, if you're doing the old examination, you have to write in this section. Okay? So what are we going to write in this section? So think about what Joe can do for himself, or what Joe can do independently based on this intervention. You could write Joe will be able to rate his pain. Okay? Probably this is one of the examples. So alternatively, you could also write Joe will be able to give the characteristic of the pain. So that is your number 1. Okay? So number 2, any question? Number 2, what are we going to monitor in terms of pain? Monitor observations. So in the UK, vital signs, we commonly refer it as observations. Okay, monitor observation and escalate as per news policy. Let's say if you're in pain, remember, if you're experiencing pain, it also alters vital sign. Is that correct? So probably if you're in pain, it can increase patient's blood pressure. It could also increase the patient's respiratory rate and also the pulse rate. Yeah, all of us probably, we've all experienced pain at some point in our lives. So probably you all know that it could affect vital signs. Yep. So that is your second. That could be your second intervention in terms of your pain. So what are we writing at this section? Joe will be able to. Joe would be able to cooperate. Joe will be able to cooperate. Let's say in terms of the vital signs taking, Joe will be able to consent. So probably consent in terms of taking the vital signs. Okay? So along those lines, what are you going to provide for your patient? Or what do you want to receive when you are in pain? Love, comfort. Well done. Thanks, Serena. Or relaxation technique. Okay? Provide, let's say, provide comfort. Or can we provide a quiet and a calm environment in terms of comfort? Yeah? Are you all happy with this? Alternatively, Anna is saying a safe environment. Yep. So you're happy with this one? Provide a quiet. I think my spelling is wrong. There you go. Thanks, Grammarly. So provide a quiet and a calm environment, or provide a safe environment for your patient. Because remember, if you're in pain, a lot of things could happen. Okay. Remember, we have to reduce the triggers of the pain. Remember, if the environment is chaotic, it could contribute to the pain. Okay? It could contribute to the pain. So what are we going to write in this section? Probably Joe will be able to relax or rest. Okay? So, thank you for your answers, guys. Well done. So, Roslyn said pain medication. So, just write the medical term, analgesia. Okay? Analgesia. And monitor for its effectiveness. Roslyn is asking, do we need to perform it after 30 minutes? Of course, why not? So, on your evaluation date, you could write after 1 hour or 30 minutes. Okay. So remember, if you're in pain, we all know that if it's like you're administering IV medications, let's say IV paracetamol, we all know 15 to 30 minutes, you will see the effect. But for medications, let's say oral medication, it will take an hour or so. Okay. So you could also do that on your care plans. If you want to write after 30 minutes and if the patient condition changes, that is also correct. Okay. On your examination. So, what are we going to write on this section then? Joe will be able to comply with the medication. Yeah, medication. So, this is one of the example for your patient's healthcare activities. Well done, guys. Thank you for your participation. Okay, thank you for helping me out. And assist. What are we going to assist Joe with? Okay, guys, you are not limited with these words. You can always add some more words, but thank you. So Maria said, assist patient in performing deep breathing exercises to alleviate pain. Probably assist or probably encourage the patient to perform exercises. Yeah. So you can also write assist, encourage, or educate the patient on how to perform deep breathing exercises. Yeah, are we all happy with that? So deep breathing exercises, it's one of our non-pharmacologic interventions for the examination. So what are we going to write in this section? Probably Joe will be able to perform deep breathing exercises. We could also write assist Joe in a comfortable position. That can be one of your interventions for the pain. Okay? Thank you, guys. So, educate. What else could we educate the patient with? You could educate the patient about the signs and symptoms. So, thank you, Aljon, for that. Um, well done. Thank you for all your contributions. So, Maria also said we could educate the patient how to manage pain at home. Of course. Well done. Why not? Okay? Why not? Griselda or Marie said, educate the patient on the side effects of analgesia. Of course, we could also educate the patient. So we have a lot of patient education. You could probably write on your care plan for your pain. Okay? So what are we going to write in this section? Probably Joe will understand the signs and symptoms of pain, or if you're doing the other one, Joe will be able to understand how to manage pain at home. Okay? So those are your examples. Sorry for my spelling. All right. There you go. So any question? Oh, lastly, refer. Where are we going to refer the patient, or in case we're going to refer the patient to whom? In terms of pain, please type your answer. Management team, pain team. Oh, guys, so remember this. I know probably, well done. Thank you, guys. So the best person that you're going to refer the patient with is not the pain team. Okay? We will refer the patient to the medical team instead. If the pain persists, I will tell you about it in a minute. So refer to the medical team if the pain persists, or if there is any uncontrolled pain. You only refer the patient to the pain team if the pain is chronic. Second, if the patient is probably end of life or the patient is a cancer patient. So that means a normal paracetamol is not effective to the patient. The pain is idiopathic, or the cause of pain is idiopathic. Remember, when you say idiopathic, the cause is unknown. Instances, you're going to refer the patient to the medical team. So I'll give an example. Let's say me, now I'm experiencing headache. Will you refer me to the pain team? Of course not. Okay? They will not accept your referral. Okay? So let's say chest pain. Probably the pain team is not the most appropriate team to refer myself with. Okay? So again, the most common instances we're going to refer the patient to the pain team. So hopefully that clarifies some of your doubts, all right, or questions. So what are we going to write here? Probably Joe will understand. Oh, sorry, I'm not screaming. Joe will understand the reason for referral. So this one on your screen is an example of a care plan for your OSCE. Okay? So hopefully this is useful for your care plans. Okay? Shall we do another one? I think earlier one of you said shortness of breath. Okay? Shall we do shortness of breath next? I think Joe is experiencing shortness of breath.
Here's what I found.
Oh, sorry. Siri is joining our session. You happy with this? So guys, if the patient does not experience this during assessment, please do not write anything about shortness of breath. Let me give an example. The scenario is all about shortness of breath, or I think the scenario was all about pneumonia. Okay? But during assessment, the patient did not complain any shortness of breath. During A2E assessment, the patient's saturation is normal, the patient's respiratory rate is normal, but the scenario is all about pneumonia. So that nurse just assume that the patient will experience shortness of breath. Again, guys, if that problem is non-existing, please do not write it as your care plan because that may result to a fail. Okay? Or that not might. That will definitely result to a fail on the examination. Okay? What is our aim of care for this problem? Joe will have a respiratory rate of 12 to 20. Joe will have a respiratory rate of 12 to 20 cycles per minute. Okay? So that is our normal respiratory rate. Are we all happy with this? Thank you for that, Dalal. So reevaluation date. So when are we going to reevaluate the patient? So remember on the scenario earlier, the patient's new score is 5. Okay? So remember, if you recall your new start, 5, that means minimum of 1 hourly monitoring for your patient. So help me guys. When is our reevaluation date? After, right, 1 hour? All right. Happy with this, guys? Hour or after 30 minutes. Okay, so you could write after 1 hour and if the patient condition changes, or after 30 minutes and if the patient condition changes. Okay, so how about the intervention? So these are the words already. So please help me supply the remainder of the phrases or the sentences of the words. Assess. What are you going to assess with the patient? Well done. Thanks, Aljan. Assess, he said, the quality of breathing. Well done. What else? Anything else for the word assess? Guys, do you have any other thoughts about assess? But this is correct, Aljan. Thank you. None? How about here? What are we going to write for the patient self-care activities? So guys, just remember, patient self-care activities is only applicable for the nurses taking the old examination. Assess for change in breathing patterns such as use of accessory muscle. Thank you, Dina. So you can just add that, okay? You can just add that. But actually, when you say assess for the quality of breathing, so that is already included there. But yeah, thank you. Well done, Dina. So Joe will be able to, Alden said, verbalize the characteristic of breathing. Yeah, probably If you won't be able to assess it yourself, probably you could ask Joe. Okay, so you could probably ask Joe. Thank you for that, Aljan. So next is able to. He said, Aljan said, Joe will be able to verbalize the characteristic of his breathing. Monitor. How about monitor? What else are we going to monitor? And so Maria said monitor his saturation using the pulse oximetry. But guys, remember when you're doing the news chart, it's not just the respiratory rate. Remember, you need everything. Okay? Well done. So Dina said monitor TPR, blood pressure, all that. So just simply say monitor the observations, and similar to like earlier in Escalate, as per news policy. Okay? So that's because remember, when you are referring the patient to a doctor, of course you're not saying, oh doctor, my patient's respiratory rate is 26. Normally the doctor will ask you, what is the news score? Okay? So you make sure you have the news score. So that means you need to know all the vital signs for your patient. Okay? So please do remember that. Okay? So monitor the observation and escalate as per news policy. So hopefully that is useful for your other care plans. So provide. What are we going to provide the patient with? Or any other words that you can think of? Yep, help me guys. Provide. If I'm short of breath or if I'm out of breath, what are you going to provide? And probably you could also answer the remainder of the words here. Deep breathing exercises. Thank you. Thank you. I can see a lot of answers now. So probably we could oxygen. Do we classify oxygen as a medication? What do you think? Is oxygen a medication? Yes. So administer oxygen as prescribed. Okay? Administer oxygen as prescribed. Deep breathing exercises, why not? Else, assist. So earlier, when for pain, we said assist the patient to a comfortable position. So what do you think is the best position for the patient? Thank you, Rosalyn. So Rosalyn said position, comfortable position. But remember, guys, what is the best position for a patient struggling with breathing? Upright position. Well done. Remember, use medical terms. Assist in a high Fowler's position or a semi-Fowler's position. Okay? You can also write assist in an upright position. Do we all agree that that is the best position for a patient struggling with breathing? Where are we going to refer the patient with? There are two possible answers. First, the medical team. If, let's say, refer to the medical team if the shortness of breath persists. Alternatively, let's say, I will give you some more information. Let's say the patient is also is asthmatic. Okay, the patient is an asthmatic. So probably you could also write respiratory therapist. Okay, so you could also write that again if it's appropriate. Okay, you cannot just refer the patient to anyone. Again, probably for this patient, the best referral would be the medical team because he's not, I don't think this patient has any existing problems in terms of asthma. So remember guys, for this patient, the patient is experiencing shortness of breath because of heart failure. Okay? Because of heart failure. So probably the best team that we could refer the patient with is the medical team. Okay? If the shortness of breath persists. But for your other care plans wherein you think respiratory therapist is the most appropriate team, then you can refer the patient to them. Because we're running out of time again, I will leave it up to you. But I hope you got the gist on how to fill out this section. Provide the call bell. Okay, well done. Thank you, Maria. So guys, just to let you know, I know probably in your care plans, when you're writing your care plans, you normally write give consent, ask for the consent, provide provide the call bell, explain the procedure. So those are the interventions wherein you're just filling out the gaps. Okay? So remember, you've asked the consent already during assessment. Okay? The patient already agreed that you're doing the whole thing. Okay? So probably if you're writing the care plan, again, just do not write explain the procedure. Ask for the consent, give the call bell. But there are care plans wherein these are appropriate, okay? Explaining the procedure, giving the call bells. There are certain care plans wherein these interventions are appropriate, okay? So always remember that. But it's not like, it's not always appropriate for all the possible care plans or problems for your care plans. Yeah, so always remember that. Probably let's talk about that after this. Provide comfort. I think it's similar to this one. So let's talk. Think about environment, guys. Well done, well done. A safe environment. So again, provide a safe. You could also write a quiet. What else? A calm environment. Yeah. So probably that could be one of your intervention. Can you see the pattern now? Okay. Can you see the pattern for your care plan? Yep. Thank you. Well done. Hopefully, I'm making things easier for you guys. Okay. So